Assalamu alaikum. Welcome to Dermatology Journal Scan of June 2026. Starting with psoriasis, in the Journal of the American Academy of Dermatology, a retrospective cohort study examined the risks of melanoma and non-melanoma skin cancers in patients receiving tumor necrosis factor inhibitors for various immune-mediated diseases. In the whole cohort, as well as patients with Crohn's disease and autoimmune uveitis, TNF inhibitors was associated with an increased risk of development of melanoma and non-melanoma skin cancers, in contrast to patients not receiving TNF inhibitors. The opposite was observed in patients with psoriasis, psoriatic arthritis, and rheumatoid arthritis, with a decreased risk of development of such tumors, and this data is reassuring for our psoriasis patients receiving tumor necrosis factor inhibitors. In this review by Shen et al., the authors argue that Alzheimer's disease, which is a known associated comorbidity with psoriasis, may actually benefit from systemic psoriasis treatments through modulating the dysregulated immune response that may drive Alzheimer's disease progression. For atopic dermatitis, Kosolitsky et al. Summarized all available research regarding dupilumab immunogenicity in patients with atopic dermatitis. They state that in 2 to 16% of patients of all age groups, anti-drug antibodies to dupilumab can be detected, but only in 5% affected with these anti-drug antibodies are the antibodies neutralized. Nonetheless, in most cases, presence of anti-drug antibodies did not seem to alter the expected response of dupilumab. The next article assessed the benefit-risk value of upadacitinib versus dupilumab in treatment of atopic dermatitis. Although upadacitinib was more helpful in improving itching and control of eczema activity, dupilumab was more safe and required less lab monitoring than upadacitinib, and the author's final analysis showed a better benefit-risk value of dupilumab over upadacitinib. For androgenetic alopecia, Shakur Martinez et al. Revisited a very old device that delivers low-level electric current to the scalp to stimulate hair growth. The tested device, in comparison to a sham device, showed a better hair density and thickness after 6 months of use. The proposed mechanism is thought to be through electric stimulation of the hair follicle stem cell, direct effect on cellular proliferation, modulation of growth factor, increasing blood flow, vascular and extracellular matrix remodeling. A very important article in the Dermatology and Therapy Journal studied the time needed to treat alopecia areata with baricitinib to achieve the desired response. For severe alopecia areata, 6 to 8 months period is needed for a SOL score of 20 or less in about 60% of patients, and this number may possibly increase to 75% at 1 year of treatment. On the other hand, for very severe alopecia areata, at least 1 year is needed for around 50% of patients to achieve such score.